Hi, I'm Amy Dunn, the Medical Director of the Hemophilia Treatment Center at Nationwide Children's Hospital in Columbus, Ohio. I'd like to talk to you about the initial management of a patient with hemophilia who presents to the emergency department. Hemophilia is rare, but the bleeding consequences can be severe. So when our patients come to the emergency department, we really need and appreciate your help. The initial care of most patients with hemophilia in the ED involves factor replacement. And in order to deliver care to these patients, there are 4 pieces of information that you need to know. The first is what kind of hemophilia does the patient have? And there are 2 types of hemophilia: Hemophilia A, which is factor VIII deficiency, also known as classical hemophilia, and Hemophilia B, which is factor IX deficiency and was previously known as Christmas disease. Once you know what kind of hemophilia your patient has, the next thing you need to know is whether they have an inhibitor or not. Inhibitors are antibodies against factor VIII or factor IX, so if you have a patient with an inhibitor, they will likely not respond to conventional factor products, and you would need to consider a bypassing agent like VIII or Novo-7. The third thing to consider is the severity of the bleed. Is this a major life or limb-threatening bleed, or is this a minor bleed? Here are some examples of major bleeds. The initial treatment for these types of bleeds would be 40 to 50 units per kilo of factor VIII, or 80 to 100 units per kilo of factor IX. These are considered minor bleeds and would be treated with a factor VIII dose of 20 to 25 units per kilo or a factor IX dose of 40 to 50 units per kilo. The last thing you need to consider is what brand of product the patient uses. In pediatrics, we try not to switch between brands due to the theoretical risk of developing an inhibitor. Sometimes patients will bring their own factor to the emergency department, so you or someone in your department might need to mix it. All factor products come as a powder and are mixed with sterile water just prior to infusion. While the kits might look different, they all have the same components and come with a mixing kit that's easy to use. In summary, there are 4 things you need to know for the initial management of a patient with hemophilia who presents to the ED. What kind of hemophilia the patient has, whether or not they have an inhibitor, whether it's a major or minor bleed, and the brand of product the patient uses. Thanks for listening, and please don't forget to call your local Hemophilia Treatment Center for additional advice.